Hello everyone, welcome to the official channel of Bashkir Medical University. Today we have an honorable guest, Dr. Khaleel sir, the founder, the director of Arise Medical Academy. Sir, I have some questions for you.
That,
Uh, how you like Bashkir Medical University
mm.
when you came here?
Thank you so much, Arjit, and it's a great honor and pleasure to be here with all of you guys here at Bashkir State Medical University. And especially, I've come at a time when it is Christmas and New Year, so it is very beautiful. The campus is so well lit and sort of good lightings and a lot of snow. So
Yes,
it's
sir.
a beautiful place to be here in Ufa at this time.
And about the university, sir?
University is very good. I When I came last time in 2019, there were a lot of constructions happening. Now I see beautiful infrastructure, lot of buildings available, and the kind of facilities the university is providing to the students, the auditorium, the classrooms, and the hostel facilities have improved drastically compared to the last time I visited pre-COVID. And I see a lot of students actually involved in academics. I've
Yes, sir.
heard people getting into conferences, traveling for international
Yes, sir.
conferences across different parts of the Russia. So it's nice, and uh, there is a lot of academic activities also going on along with the extracurricular activities in the university. So it's a really beautiful experience here in Bashkir.
Sir, the key focus of today's video is about FMJ aspirants. What are the key areas to focus for the FMJ aspirants who are in 4th, 5th, 6th year now?
Okay. Now, the first thing for all the students, medical students studying abroad, this is my strong suggestion, is to prioritize FMG. Uh, Back in India, when we deal with students coming back and facing this exam, what the major difficulty we have seen is people come very unaware and come with a carefree attitude and then realize the seriousness of this exam. So more than hard work, more than IQ, it is very, very essential that they start early upon this preparation. So it is no plan B exam. This is an essential exam to get your license done. So first prioritizing it. So what I would suggest is every student, not just fourth, fifth, and sixth years, every student, along with their semester subjects, if they are studying anatomy, study parallelly for FMG of anatomy. If they are studying physiology, see that you complete the physiology material that is being tested for your FMG, do the question banks of that subject. So simultaneously, bridging that gap is important. Don't postpone it till your last years or final years. And for fourth, fifth, sixth years, the time is of crucial importance. And even if they give if your student is in fourth year, if he can give 2 hours every day and build it very religiously, that focus 2 hours of FMG preparation, I think he will be able to clear the exam very smoothly. Sixth years, I would say it is high time. This is the last semester. They are going to have 6 months of time before they come back to India and start. So this is the time they want to be very responsible about their own lives, about their family back home. They want to go back as doctors. This is the time they need to, switch the things from whatever they were doing for the last 5, 6 years. You had good time, you had good friends, good time at the university, but you have to now plan how you are going to, go back to India and how you're going to face this exam. So I think this 5, 6 months, if they can stay determined, there are a lot of resources available, there are a lot of resources available to complete the preparation. A commitment is needed. An intense phase of preparation is needed. I would want all the sixth years to complete as many subjects as come and plan your revisions back in India. Don't think that you will come and prepare in India. Especially in sixth year, there's a mindset that okay, these are my last 6 months. I want to enjoy. You will be enjoying throughout your life. Once you are having your degree, once you're passing your FMG, you will come back with your own money. You will have exploring in a much more happier way. Don't spoil that phase just because you are wanting to enjoy it in the last semester. You can have your graduation ceremony, you can have your commitments, but it doesn't mean that all 6 months you have to spoil that way. Have small blocks where you actually spend time with your classmates, spend time with your things, but prioritize FMG preparation if you want a smoother journey back in India. You don't want to lose out on the first attempt. A sixth year student should understand the importance of first attempt. If he passes in the first attempt, his NEET PG qualification will be on time. His internship will start on time. So why to spoil the time when he is available here in the university and then take a very risky game back in India? When an exam is a 20%, 30% pass percentage, going prepared is needed. So I would suggest all sixth years to get little serious towards their preparation.
Thank you, sir,
Yeah.
for the wonderful answer which you gave. It's very, very good. And the second question is, can you please tell us that which is the less important subjects for now for the 6 year students which can be covered in India?
Yeah. Now, all 19 subjects are important. You cannot go into this examination hall without doing 19 subjects. But as you're asking what subjects are not important, I would say you can postpone some subjects which you can complete in India, which requires a good, these are easy subjects to cover, even in exam pressure, even very close to exam, you can cover those subjects. These are like subjects like dermatology, psychiatry, subjects like anesthesia, right? Forensic also you can complete back in India. But I'll tell you what subjects they have to do it here. You cannot carry them back to India.
Back to India.
Those are like pharmacology. Pharmacology is lot of
Information.
classifications, lot of memorization to do. More than your willpower, it also requires time. So in India, you are in having a lot of willpower to complete the exam and all, but time won't be sufficient there. So it's better to complete subjects like PSM, subjects like pharmacology, get your concepts of pathology, anatomy done. So this will give you a very core structure, very strong, so that when you come into an intense phase, you are actually able to know your basics well and carry them forward. So I would say pharma, PSM, complete your patho, complete your anatomy before you come back to India. If you want to postpone some subjects, derma you can postpone, psychiatry you can postpone, forensic you can postpone and come.
Okay, sir. Thank you. So, why the passing percentage is so less in FMG? Like it's only 18%.
Yeah. I mean, consistently, I mean, luckily from the last couple of exams, this percentage has slightly increased to 25 to 30%. But I feel the major problem is not with the exam, but because of the late start of the students. If you look at the PYQs and all, the questions are from the topics that are being emphasized regularly in all the classes and all the content. The problem is students take this much easier. They are in their university life, they are in their own survival mode, and they think this is not a major, they'll postpone all of this preparation back to India. And that is a major problem. I see many committed students trying to work very hard, but they have to complete 19 subjects with complete details within a short duration of 3 months. And that is where the pressure builds in. It is not that the students are not studying. Everybody, once they are back in India, now with this exam going time, you will see students 2 o'clock in the library, 3 o'clock in the night in the library. So students are working hard. Only mistake they do is they take a lot of burden and come back to India. And this 3-4 months that they get cannot complete so much of vast content to a level of perfection with revisions and stuff. So it is essential that they start early, especially the last semester students. I would strongly recommend, see you complete as many subjects as possible and come back prepared. So the reason the percentage is less is because of a late start only. That is the single most important criteria, I would say. And today students are a lot of distracted also. The focus is reduced. They want all, this is good, that is good, this is nice, that is nice, and they don't sit down and focus and complete. Even they buy so many online applications and all, if they use, look at the usage, hardly 30%. They are renewing it year on year, spending 40-50,000 rupees on it. Everything is available. This is a generation which is not a lack of content is easily available for them. This is a generation which has a lack of commitment. The moment they get committed and content complete the content, these guys will do amazingly well. So what is needed is a commitment to complete.
Okay. Thank you so much for this
Yeah.
answer. Now, this is a simple question. Like, what makes a doctor a good doctor?
I would say, you should have the empathy. I would say in life, it's all about being happy. Whatever you do, what kind of duty you do, if you are empathetic to your work, empathetic to your patients, and do it with a sense of responsibility, sense of truthfulness and honesty in whatever you're approaching. I think that sense of satisfaction is important. A good doctor is, for me, is a one who can keep his patients happy, who can relieve their pain, and who can keep the patients happy. And this requires a very transparent, honest approach towards their patients, towards the discussion. And a lot of communication skills also have to improve. We see a lot of doctors back in India, they are good at their skills, but because of the communication being not in the proper thing, they are not able to convey the message. The patients don't get convinced with the doctor, or they don't regard the doctor, because the communication from the doctor has been very poor. But whereas the other non-qualified people, they are communicating the misconceptions in a better way, and these student patients get trapped into that. So it is important that our doctors, along with the skill set, also carry good communication with their patients and also carry empathy towards the patient. So understand what the patient, how would we want our doctor to be treating us when we are ill or when our family members are ill. If we can keep this in mind throughout our practice, right? We'll have the same empathy towards our patients. I think the communication and the bond between the doctor and the patient would improve, and that would help the healthcare also in overall across the country.
So last question
Yeah.
and last thing. What will you say to the FMGS parents who will watch the video?
To all the students who are watching me, this is a essential exam for you. This is a licensing exam. This is an exam that will give you the license to practice. This is the first gift that you're going to give to your family. The first gift that you're going to give to your family is the passing certificate, the licensing certificate. Don't deny them that happiness. So become responsible. There is content available, but don't be in a casual behavior. I'll study back home. I'm studying better than my roommate. I'm studying better than my group mate. Please remember, in this exam, 149 equals to 0. 149 equals to 0. It is not enough if you're just better than your roommate, your classmate. When a 80% percentage of students are not clearing the exam, you cannot be happy just because you're better than your roommate, your group mates and stuff. Are you good enough to clear the exam? Right? Are you doing enough work to see that when you sit on your papers, when you're looking at your subjects, are you able to cross that 50% mark? And 150 is not equal to 300 now. The internship slots are so difficult back in the country. The more scores you get, the better chances for you to get an early internship, a better internship in a medical college or a hospital of your choice. So if you can start early, be sincere with your approach, have your dreams and goals passionately, be passionately attached to your dreams and goals. I keep telling, this is your time to dream, your time to achieve. Be passionately be attached to your own dreams and your own goals. And if you can come out with very good scores, pass out with very good scores, you will get your internship of your choice at your city of your choice. You can plan to go internship from your home. You want to get an internship in a government hospital, you can do that. It all based on the scores. And all the good students listening to me, at least 165. Don't just target for 150. If you want to be eligible for INA set, right, in future, the minimum score that you need to get is 165. And INA set is not just for AIMS New Delhi. AIMS today is available in many states, right? So there are so many postgraduate seats that are there. In so many state capitals, you have a AIMS now. PGI Chandigarh, JIPMER, these are institutes of national importance, right? So these are central institutes. Having any kind of degree from these institutes will change your careers. So don't deny yourself. The good students, don't deny yourself this opportunity. So if you can study well and target to get more than 165, not just passing by 150. If you can get more than 165, the kind of happiness that you will get and the kind of opportunities that you will get is going to be amazing. So start early, and do remember, 149 equals to 0 and 150 is not equal to 300. So have a very clearly defined goal. I want to pass FMG in my first attempt with very good scores. All of you will pass FMG. Some will pass in 6 months, some will pass in 6 years. So have a clear goal. I want to pass FMG in my first attempt with very good scores, and work for the goals of yours.
Thank you so much, sir.
Thank you
Thank
so
you
much.
so much,
It's
sir.
been a great experience interacting with all the students here. I wish to see more students, interacting, learning, and evolving. And we are there to support throughout. But we have been traveling to Bashkir. A lot of our faculties have been traveling to Bashkir, and we hope to support as much as possible from our end through different faculties coming in, and we expect equal enthusiasm from the students to actively participate in these sessions and evolve in their academic journey with us. Thank you so much, Arjun.
So that's now we are logging off. Thank you so much.
Thank you.